Admission for follow-up examination. When a patient is admitted for the purpose of surveillance after the initial treatment of a disease or injury has been completed, a code from category Z08, Z09, or Z39 is assigned as the principal diagnosis or reason for the encounter. Examples include Z08 encounter for follow-up examination after completed treatment for malignant neoplasm. Z09 encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. C39.2 encounter for routine postpartum follow-up. If a recurrence, an extension, or a related condition is identified, the code for that condition is assigned as the principal diagnosis rather than a code from categories Z08, Z09, or Z39. Examples include the following. An asymptomatic patient who had a resection of the descending colon a year earlier is admitted for colonoscopy to evaluate the anastomosis and determine whether there is any recurrence of malignancy. Colonoscopy proved the anastomosis to be normal, and there was no evidence of cancer recurrence. In this case, code Z08, encounter for follow-up examination after completed treatment for malignant neoplasm, is coded as the principal diagnosis, with the additional code C85.038, personal history of other malignant neoplasm of large intestine, and a code for the colonoscopy. An asymptomatic patient who had a resection of the descending colon a year earlier is admitted for colonoscopy to evaluate the anastomosis and determine whether there is any recurrence of malignancy. Colonoscopy showed the anastomosis to be normal, and there was no evidence of cancer recurrence. However, a polyp of the transverse colon was found, and it was removed. Pathology examination showed it to be an adenomatous polyp. Code D12.3, benign neoplasm of transverse colon, is assigned as the principal diagnosis, with code Z85.038, personal history of other malignant neoplasm of large intestine, assigned as an additional code. In this case, code Z08 is not assigned because a related condition was identified. A patient who had a colon resection for removal of carcinoma of the descending colon 1 year ago is now seen for follow-up examination to evaluate the anastomosis and determine whether there is any recurrence of disease. Colonoscopy showed normal anastomosis but revealed a recurrence of cancer at the primary site. Code circa 18.6, malignant neoplasm of descending colon, is assigned as the principal diagnosis. Code Z08 is not assigned. A patient who had surgical excision of a malignant neoplasm of the ovary 1 year ago, followed by chemotherapy, is admitted for follow-up examination. There is no evidence of recurrence or metastasis, and no other pathologic condition is identified. Code Z08, encounter for follow-up examination after completed treatment for malignant neoplasm, is assigned along with the additional code Z85.43 to indicate the history of ovarian cancer as the reason for the examination. A patient who had benign polyps of the colon removed 1 year ago is now admitted with complaints of pain in the left lower abdomen. A colonoscopy is performed to determine whether there is any recurrence of colon polyps, and the results are entirely normal. In this case, code R10.32, left lower quadrant pain, is assigned rather than code Z09 because the abdominal pain was the reason for the admission. Code Z09, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, may be assigned as the reason for encounter only when the patient is no longer receiving treatment.